Then let me move on to quickly to some other system reform. The payment to your providers have to be changed. You need a uniform, right now your current payment methods and rates are highly varied among your health insurance plans. And the rates vary. You know Medicaid pays less than Medicare. Medicare pays less than the private insurance. You already know that. But if you dive into the methods of payment, at least I found it's like a maze. And it took me 3 days to consult with your Vermont expert before I even had a grasp of that complexity, and I will call it a chaotic condition. If I'm a provider, I will be lost. And that's why providers call it the administrative hassle. It's just really a hassle when you delve into it on the different payment methods and the rate. So we recommend you move to one uniform payment method for all insurance plans, including Medicare, and the same rate of payment. But then you should move toward capitation payment for the ACOs, because it's through the ACOs you're going to establish and create an integrated delivery system in Vermont. But that will take time to move for that. Then next is Vermont to move toward ACOs. And in our proposal, we have quite a few pages. By the way, our report is more than 200 pages. And I'm sorry, we're trying not to chop down too many trees, so that our report is only going to be available on the internet. I already mentioned about the design of benefit packages. Let me just highlight the difference between essential and comprehensive benefit package. Comprehensive benefit package will have very little cost sharing by the patient. They may only have to pay $5 for office visit to try to reduce the unnecessary demand for services. But they do not have to pay very much at all at the time of the service. And second, you will include fully the vision care, the dental care, nursing home care, and home care. But meanwhile, the essential benefit package will require the patient to pay more, like $15 or $20 when they go see a doctor, but no deductible for ambulatory services, because you want to encourage patients to go see a health professional early for early detection and treatment, so their illness will not become more acute. The essential benefit package, like I said earlier, will not cover home care and the nursing home, but it will only expand dental and vision modestly. Next. Then let me go to the results and the impact. The impact, we start by looking at the impact of PPACA, because we want to lock in the federal funds that will flow through this system. Under the PPACA, when it's implemented in 2014, PPACA is going to be phased in. Under the President Obama's estimation, First year, only 30% of the eligible will actually buy the insurance. Second year, 60%. Third year, 90%. It takes 4 years for all the eligible people to enroll into the plan. This is based on the experience of Massachusetts and some other states. So it's not just pulling things out of thin air. You can see that on the most right column, we estimate that in the year 2015, after 1 year of implementation, the PPACA will reduce your 50,000 uninsured by 18,000 people. So there's still another 32,000 remain uninsured. There will be an additional roughly $240 million flow into Vermont for that program. That's made up additional support for Medicaid program, tax credit subsidy for the employers who provide insurance for their employees, and the subsidies to the people who enroll in the exchange program for those people who are low income. By 2019, when the PPACA is fully implemented and taken up, we estimate the additional fund flow into Vermont would be close to $420 million. All these dollars we show on our charts and tables are in 2010 dollars. Okay? They are not nominal dollars, but what's the purchasing power in 2010. Then, next. So this is the baseline. We want to lock in this 240 million up to $420 million for Vermont. In the next slide, I need to explain the first column, which is labeled projected contribution rate and the PPACA. That's a mislabel. We have to find something we can compare the impact of different options. So then we are trying to translate what the employers will pay now, what the employees will pay now in premiums, if that's translated into payroll, as a percentage of payroll. Right now, according to the best information we have for Vermont, last year, your average employer who offer health insurance pays 11.3% of their payroll for health insurance premium for their employees. 11.3. In this chart, you see we projected in 2015 that employer will be paying 12%. That's the second row there. Then, if you compare for the employers and the option one, they're going to save 1% of the payroll. Under the comprehensive benefit package, employers have to pay 2.5% more of their payroll. That's what they're paying in premium now. And then under option two, there's no change because that's a public option. And then the third option, which we're going to recommend, also will save roughly 1% for the employer. You can look at the employee contribution. You can see the same kind of drop compared to after we lock in the savings for Vermont under PPACA, compare what the employers and workers have to pay in premium, which is shown in the first column, as a percentage of payroll. Then you see the difference, how they will be affected. We make sure in our design of the benefit package and everything, their cost, what they have to pay, is less than what they will otherwise have to pay. That's what that table tries to illustrate in our recommendation. Then, what are some other impacts? I'm sure everyone in this room would like to know, how does that affect the number of uninsured? Well, option 1, single payer, or option 3, the public and private single payer, will insure everyone. So every Vermont resident, qualified resident, will be insured. Under option 2, there will be still roughly 32,000 remain uninsured. Then you look at which give you the dollar figures. These are approximate numbers. Like I said, these estimates have a margin of error of 15% and some maybe 20%. You see